Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Abdullah Atiyah. Here I'm going to talk about the physical activity to prevent and treat hypertension. And in the introduction, the cardiovascular disease. It's a leading cause of death in the United States and the world. Mostly, half of the deaths in the United States are caused by the cardiovascular diseases, and the hypertension is the most common and preventable cardiovascular risk factor. And 1 in 5 people with pre-hypertension will develop hypertension within 4 years. And the methods is to see how the physical activity affects the blood pressure. The purpose of done by Umbrella. The purpose of this Umbrella review was to identify systemic reviews and meta-analysis published since the 2008 by PAGAC report that examined the relationship between the physical activity and blood pressure among adults with normal blood pressure, pre-hypertension and hypertension by the JNC 7 blood pressure criteria. And the method, study and sample characteristic, qualifying reviews included one systemic review of longitudinal studies with a minimum of 1 year of follow-up and 17 meta-analyses of recognized control trials. The systemic review leads to sample in qualifying reports where generally an equal mix of men and women, both genders, are examined, and followed. It's Caucasian followed by Asian, some African, and Indian samples. Here, the evidence on the overall relationship between the physical activity and blood pressure. It's defined in two ways. Blood pressure responds to an exercise regarding its intensity, if it's high, low, or moderate, and the daily physical activity, like going to work, anything, but not exercises. And here we are going to talk about the first point. The studies revealed that there were 8 meta-analyses examined by blood pressure response. They were in active adult with pre-hypertension and normal blood pressure. 5 of them reported reduction in systolic blood pressure, while 4 reported reduction in diastolic blood pressure. Overall, the magnitude of the blood pressure reduction ranged from about 2 mmHg for systolic blood pressure and 1 to 4 for diastolic blood pressure. And here we are talking about the dose response relationship between the physical activity and the incident hypertension. Among 330,000 and 222 adults with normal blood pressure, in six cases hypertension occurred after 20 to 2 to 20 year follow-up. 20.5% of the samples. However, the available evidence is insufficient to determine whether a dose-response relationship exists between the physical activity and the incident hypertension among adults with pre-hypertension. PAGAC grade is not assignable. And here, the treatment of hypertension, we regarded the blood pressure response to physical activity among adults with hypertension as indicator of cardiovascular disease progression. So the physical activity is very important. The blood pressure response to the physical activity. Strong evidence demonstrates that physical activity reduces blood pressure among adults with hypertension. So you have to take care and change your lifestyle and be healthy and do exercises to reduce blood pressure and to not get an hypertension. And the relationship between physical activity and cardiovascular disease mortality. Moderate evidence indicates an inverse dose response relationship between the physical activity and cardiovascular disease mortality among adults. Evidence on specific factors. Specific factor that affects the blood pressure: age, sex, ethnicity, socioeconomic status, or weight status. That's all affect the blood pressure. The frequency, intensity, and duration, or how physical activity was measured. The frequency is ranged from 1 to 7 days per week, with an average 3 days per week, and the intensity graded from low to various intensity. Virus mean high intensity, and with a low and the most common is low to moderate. And the time of exercise are ranged from 12 to 100 minutes, with most common is 13 to 60 minutes. And the discussion we talk about evidence was strong demonstrating the physical activity reduced blood pressure among adults with normal blood pressure, pre-hypertension and hypertension. The blood pressure reduction of the magnitude may be insufficient to reduce the resting blood pressure of some of the samples of the hypertension into pre-hypertensive and normotensive range, and the risk of coronary heart disease by 4 to 22% and stroke by 6 to 41 among adults with hypertension. So we found strong evidence demonstrating the magnitude of the blood pressure response to physical activity varies by resting blood pressure levels, with greater benefits occurring among those with higher resting blood pressure. We found a lot of adults and peoples underestimate the effectiveness of the physical activity as antihypertensive lifestyle therapy, so it's very important. And we found moderate evidence that aerobic and dynamic resistance exercise training alone or combined were equally effective in lowering blood pressure among adults. In conclusion, this systemic umbrella review provides strong, convincing evidence of the importance of physical activity in the prevention of the development of the hypertension among adults with normal blood pressure and pre-hypertension, and of its protective effects in the treatment of hypertension by attenuating the progression of cardiovascular disease among adults with hypertension. Thank you for your listening. وعليكم السلام ورحمة الله وبركاته.